Okay, we've lost some more blood here. Actually, we're going to go in.
Yeah,
can you call an ambulance, please?
Call. Yeah.
Okay.
Okay.
How's she doing at the moment?
She's calm now.
She's calm.
Many of our students are working interprofessionally during their training. What we feel is that there's a gap with midwives working in their training with paramedics.
Okay.
When midwives go out, when they qualify, some of them will go to work out in the community, having never really worked interprofessionally with paramedics. So that's why we thought this would be really excellent.
Brilliant, that's fantastic.
We've got a stretcher just outside the door here.
One of the things that midwives and paramedics have in common is their degree of autonomy. Community midwives out in practice and paramedics out in practice in the field are very much responsible for the clinical decisions they make in the field, and so that shared autonomy and shared range of practice is good to test, and it's good to test to see how much understanding there is of the joint problems that we get in the community.
Fantastic, just breathe it in and out.
Very often, despite having similar ways of working, we don't see much of each other professionally. Paramedics and midwives meet professionally, but it's usually for very short episodes of care. So what we wanted to do was try and see whether both sides could understand better what both professions did.
This is Megan. She's 34 weeks pregnant with her. I think bringing the two professions together is very valuable because each can see each other's boundaries of care, but also to complement each other and to work for the better good of the patient. Hand over to the paramedics now.
The benefits of doing it with the midwives as well is because in the real scenario you are working as a team, and I think it's some of the problems in situations like this are because of bad communication between midwife and paramedic, and that can obviously lead to a bad outcome, bad experience for the patient as well. So also we tend to work in little bubbles, so one of the extra benefits is knowing how midwives work, picking up tips and tricks from them as well, and similarly hopefully they get a better understanding of what we do.
Okay, ready? 1, 2, 3, up.
To do this again with midwives and paramedics would be a really good idea, and I think to have it as part of a rolling programme, because you know you do things in a one-off, you know 6 months down the line you can't quite remember. It's also about developing relationships as well.
Yeah, you can start ripping up, you do the midwife magic, so to speak.
Personally, from this exercise I can take away much more detailed knowledge of what midwives expect of us and also what midwives are capable of. And there's also a nice indicator of where each of the disciplinary responsibilities lie, so you know exactly where you stand. It's very useful.
I've always thought simulations are something we should do more of, particularly for these kind of things that are not routine for us. Because simulations, even though they're not real, they at least get us a chance to practice. Some people are not comfortable with it, but personally I actually would rather have a go and make mistakes in a simulation than do it in real life, so I'd definitely do it again.